Hello, my name is Ravi and I will be doing my case study presentation on the topic of tobacco use. I'm going to begin by giving some background information. In 2001, 46.2 million adults in the United States were current smokers and about 8.6 million had serious smoking related issues. Most deaths caused by tobacco are from lung cancer, ischemic heart disease, and chronic airway obstruction. I've also listed some key statistics here. It should be noted that there is also a link between smoking and mental illness. As such, I have also listed additional risk factors. Sadly, less than 5% of smokers who quit for one day are able to do so for 3 to 12 months. Fortunately, adult smoking rates decreased by approximately 50% between 1965 and 2001. In terms of the current situation, the problem to be addressed is smoking, because it remains the leading preventable cause of death and disease in the United States. Through a SWOT analysis, we find that our strength is that we know what works to curb tobacco use. Weakness is that growing e-cigarette use among teen populations in the US is shown to make it more likely for teens to try real cigarettes, which increases the chances of tobacco addiction. Opportunity is to continue educating at-risk populations regarding the dangers of tobacco, including e-cigarettes. Finally, threats include tobacco company lobbying power, misconception about e-cigarettes, and untreated mental illness. One organization at the forefront of this issue in the United States is the Truth Initiative, which is an advertising and grassroots internet program designed to prevent youth smoking. It is actually credited for increasing anti-tobacco attitudes among young people, making it less likely that they will smoke. Its mission is to spread awareness and inspire action in the fight to end smoking. We also need to prioritize core issues. The new American generation has not been brought up in an environment where traditional cigarette smoking is considered fashionable, but e-cigarette smoking has become increasingly popular among youth. This is thought to be due to the JUUL e-cigarettes, which are shaped like flash drives, are very discreet, have very high nicotine content, and come in assorted flavors. We need to prioritize education and policy development, especially implementation of population-based strategies and regulation of tobacco products. In terms of alternatives, one case solution makes use of an attractive alternative to smoking, which is brand equity. Youth and young adults who feel more favorably toward the Truth brand are less likely to be current smokers, and those who do smoke are more likely to intend to quit smoking. Increasing the Truth brand equity or relevance was associated with extensive prevention of youths becoming smokers in the 2015 to 2016 period. This case study is related to the health belief model in that young adults are generally optimistic when it comes to their risk of developing tobacco addiction through e-cigarette use. They also believe e-cigarettes produce only water vapor and are less harmful than conventional cigarettes. Young adults also tend to underestimate the benefits of avoiding e-cigarettes, believing they are harmless and do not need to be avoided. Some young adults may feel pressure from their peers to vape, posing perceived barriers in regards to avoiding vaping. Political action, FDA regulation, taxation, and education campaigns are all cues to action. Young adults should also feel that they can successfully avoid or quit e-cigarette and conventional cigarette use with respect to self-efficacy. An alternative solution to the one I mentioned earlier would be educating at-risk youth populations about the true dangers associated with e-cigarettes and portraying e-cigarettes as gateways to conventional cigarette smoking. Another solution would be to tax e-cigarettes. This is especially useful as we have seen that laws taxing conventional cigarettes have been successful in decreasing the prevalence of smoking. I would recommend first and foremost that initiatives such as the Truth Initiative encourage young people to be involved in policy change as much as possible, whether that means contacting their representatives or, if possible, voting in order to change legal attitudes towards smoking and vaping. I would also recommend that public education be modified to include instruction addressing the dangers of e-cigarettes in school curricula, as these are the tobacco products that most affect tobacco consumption among the new generation of Americans. Here I will present my action plan. Efforts should be made on a national scale to encourage and drive policy change within the United States to address the growing popularity of e-cigarettes among the new generation of Americans, as this habit makes users more likely to also use conventional cigarettes. By 2025, all 50 states should have requirements in their curricula to warn against the dangers of e-cigarettes. By 2030, all 50 states should have laws placing a special tax on e-cigarettes. Trends should be analyzed in 2035 to see if smoking rates in adults have decreased, increased, or stayed the same, and adjustments should be made accordingly. Finally, in my opinion, prevention of smoking in younger populations today will decrease tobacco use among future populations in the United States. I believe that it is imperative that we address the growing popularity of e-cigarettes among younger populations today in order to prevent these same populations from being drawn into the use of conventional cigarettes. Failure to address this issue would undo all the progress we have made as a nation in decreasing smoking rates. Thus, deaths due to lung cancer, ischemic heart disease, and chronic airway obstruction will continue to be an issue in the United States moving forward into the future. Thank you for listening to my presentation.